Good morning, Dr. Robb. How are you?
I'm doing great.
As a classroom teacher and also as a parent of a child diagnosed with ADHD, this topic is really near and dear to my heart. Can you explain for us what exactly is ADHD?
ADHD is a neurobiologic disorder that affects about 6 million children in school age in the United States. As you know, and as your listeners would like to learn, ADHD has two main categories of issues. Kids with ADHD can have symptoms of hyperactivity, so that's difficulty sitting still in the classroom, feeling really restless and climbing and moving about a lot. There are also problems with impulsivity, so those are the kids that shout out the answers before the teacher finishes a question. They do things without thinking, they interrupt adults when they're speaking. And also problems with inattention, so that's difficulty focusing when the teacher is lecturing, staying on task while trying to complete homework assignments or other difficult things. And it's those three different areas of struggle that lead to difficulty in the classroom.
Well, it is this time of the year where progress reports usually are being sent out and parent-teacher conferences are getting scheduled. So with the parent-teacher conferences being, coming up in the next couple of weeks for many schools across the country, what is it that you think parents should be asking their child's teacher?
Stacy, that was just such a wonderful question because it brings up the whole issue of checkpoints and back-to-school parent-teacher conferences and interim reports, as they call them in my practice back home in D.C. It's when you can check in as a parent with the teacher and say, how's my child doing? Are they performing the way they should be? Are they handing in their homework assignments? I looked on Blackboard, which is one of the ways that you can check up and see if your kids handed in everything and if they've done their test, and say, oh my goodness, I didn't realize he was missing 1 English paper and 3 math assignments. What do you think's going on? And have that discussion with your teacher about what should we do next, where should we go?
Okay, then taking the flip side, as being a teacher in the classroom, what is it you think I could be doing best to help support those parents and the children in the classroom with ADHD?
Well, I think teachers are an integral part of treatment for ADHD in the classroom. If you already know that you've got a kid in your classroom with ADHD, that may mean sitting them in the front of the classroom, double checking that they've handed in their homework assignment. So in middle school, I know teachers don't always have to ask for kids to hand in their homework. They're just supposed to remember to do it. But one of the teachers that I work with always reminds the kids, knowing that some of the children with ADHD may have done their homework, but it never made it out of the backpack and into the grading basket for those homework assignments. I think also helping with breaking down assignments. So if you've got a project like what is trade in colonial America like, and they have to look on the internet, do an outline, a rough draft, and a follow-up, we can break that down into small pieces that a kid with ADHD can manage rather than just having an assignment that's due in 2 weeks.
Okay, excellent. So chunking things out and using calendars brings me to the thought that, most children I see in the classroom, and this goes for all children, really thrive when they understand and know their routines. Structure, I see, gives children lots of security and it lessens their stress. So how can parents of children with ADHD incorporate routine and structure at their home and that homeschool connection to help aid in school success?
So parents at home, again, keeping lines of communication open with the teacher is key, and also having a quiet place to do homework, checking on Blackboard or checking the backpack to make sure assignments are making it home, and then making sure they get back into the backpack and back to school. I think the other thing that parents can do is talk to their physicians about treatment. And besides that hand-in-glove work with the teacher in the classroom or educational interventions, we've also got therapy and medication for kids with ADHD. We've got patches, pills, and long-acting liquid formulations. Our partner Pfizer even has a website, ADHDcheckpoints.com, where you can learn more about some of these medications. And I think that's another important part of what parents of kids with ADHD can do.
Okay, I'm scribbling that down, ADHDcheckpoints.com. that would be a good place parents could get some more information.
Yes, ma'am.
So, Becca, you kind of covered up a little bit of how it is you treat with children with ADHD. Is there anything else you can add to that?
I think one of the things is that as kids go through school and through development, what they need to succeed in the classroom and outside the classroom may change. And so that checkpoint idea again, where every year after we're a couple months into the school year, you do a reassessment, how are things going? So when somebody transitions into middle school where the workload goes up, you have different teachers with different styles and more changing and longer class times, you may need to reassess, are we where we need to be with our treatment? And this is the right time of year to do that for parents.
As a sixth grade teacher, I completely see that whole transition into middle school. With the multiple teachers, multiple expectations, it is a lot for all children to handle. And a child with ADHD has a different level of complexity added to that transition. Well, I can also tell you that, parenting a child with ADHD can be exhausting. And so when it comes to support and information, it is key and it's vital for that extra support. Where else can parents find support?
There are a variety of places that parents can find support, and they can go to their primary care doctor, the pediatrician. They often have resources, and out to the web, beyond the ADHD Checkpoints.com. There are other things by organizations like CHADD, CHADD, which is the Parent Support Group for Kids with ADHD, and the American Academy.
Can you repeat that again? CHADD?
It's CHADD. That's the group for ADHD parents and kids. And the American Academy of Pediatrics also has information on their website.
Okay, some good information. I also do find as a teacher that many parents are afraid of their child being labeled when teachers are talking to them about specific behaviors that they see in the classroom. Are there key words that parents should be looking for when they have this conversation with parents that might lead them to go ahead and go seek out their pediatrician for additional information?
I think if a parent is having that conversation with a teacher and you know that your child is struggling, I think it's always okay to go to the pediatrician and have that conversation. What you decide to do in terms of treatment options is really going to be a family decision, but I think parents should never be afraid to at least take a look, because it's really hard when you're a kid with ADHD and you're struggling in the classroom to feel good about yourself and to feel good about school. And I don't think there's anything wrong with asking your family care doctor or your pediatrician for help with figuring out what to do next.
Well, I think all of these words have been incredibly good words of advice for parents of children and parents of children with ADHD. So, as you know, October is ADHD Awareness Month, and I really want to thank you, Dr. Adelaide Robb, for joining me today and helping parents navigate the beginning of the school year, especially when you have the issue of ADHD, adding a different level of, understanding of a transition to their life. And helping them be very successful in the classroom. I do appreciate that. Thank you.
And thank you for having me.